Now I invite Dr. Joseph Pottery, our chairman of Global Grace Health, to inaugurate the meeting and welcome.
It's my special privilege to invite everyone and welcome you for this third anniversary of Global Grace Health. We have guests joining from not only America, but even from around the world, from different continents and countries, and also especially from India. Now we'll have curtain raiser presentation.
As we step into the future, our world is confronted by a myriad of challenges: non-communicable diseases, mental health crises, disparities in healthcare, the health implications of climate change, and the rise of antimicrobial resistance. These issues demand our attention and concerted efforts as we strive to build a healthier, more resilient global community. This is the driving force behind Global Grace Health, established in 2020 with a bold vision to transform healthcare on a global scale. Our core mission is to raise awareness about preventive health, predict lifestyle diseases, and provide personalized lifestyle coaching. Additionally, we strive to promote new medical devices and digital health solutions while fostering research and development in the healthcare sector. In just 3 years, Global Grace Health has made a substantial impact on millions of lives through its collaborations and partnerships with key organizations such as Grace Cancer Foundation, Bridge Gap Hospitals, PTA, Tana, Smart IMS, High Health, Lucidus, Emerge Tech, and a few Fortune 500 organizations.
As a proud board member of Global Grace Health, I reflect upon the past 3 years of journey, which has been remarkable.
Last year, Global Grace Health joined forces with the Grace Cancer Foundation to champion Project Cancer Screening, impacting the lives of over 10,000 individuals and more than 20,000 lives over the past 3 years. Our mobile cancer screening buses reached even the most remote regions of Telangana and Andhra Pradesh, delivering healthcare directly to people's doorsteps wherever our roads could take us.
We at Global Grace Health encourage use of technology to transform healthcare digitally.
This determined campaign against non-communicable diseases has been instrumental in saving countless lives.
हमारा नाम समीना बेगम है। अल्लाह का शुक्र है, पूरा ट्रीटमेंट हो गया, लास्ट रिडिशन है और ये ब्रेस्ट कैंसर वालों को बहुत बहुत शुक्रिया।
निर्मल ब्रेस्ट कैंसर वाला आपसे निर्मल खान और कैंसर और जितने पर ये निजामाबाद तक की कैंसर हॉस्पिटल में ट्रीटमेंट చేయించుకున్నాం.
During the COVID pandemic, we led state resilience efforts, supplying essential medical aid to 25 cities through Mission O2, benefiting thousands of people. Collaborating with GCF, we supported to rapidly establish Project Ashray to address the surge in COVID-19 cases. Our mobile vaccination drive prioritized equitable access to COVID-19 vaccines for rural communities. Global Grace Health was instrumental in raising cancer awareness through Global Grace Cancer Run, with participants from 130 countries spearheading support for cancer prevention. In the US alone, the Cancer Run was held across 10 cities, such as Dallas, New Jersey, California, Colorado, Chicago, Washington, D.C., Boston, Detroit, Raleigh, and Houston.
In the last 3 years, we have made an impact, progress, made with COVID care, made with cancer screening, made with cancer awareness. In all these areas, innovation has helped us to reach many lives, and millions of lives have been touched in and through the work of Global Grace Health. Together, we could do so much in such a short span. I encourage each one of you to join hands with us, even as we aspire to see this world much more healthier. We can together make a difference.
Global Grace Health is gearing up for a remarkable journey in 2024, driven by a commitment to elevate healthcare accessibility. With an ambitious plan to conduct 100 mobile cancer screening camps, the organization aims to positively impact 25,000 lives. This initiative resonates deeply with Global Grace Health's core values of touching lives and creating a tangible, positive difference in the communities it serves.
We deeply appreciate the support we receive at Global Grace Health as we work towards our mission of promoting health, hygiene, and wellness worldwide, especially through the Grace Cancer Foundation and other partnerships, in order to reach those with minimal or no access. Thank you for standing by us and assisting us on this journey.
Please join hands with Global Grace Health, and together let us reach the unreached.
Now it is time to welcome and introduce our chief guest, Dr. Varun Jeph, Deputy Consul General of India from New York. I request Mr. Daniel Rajaya, my young friend. I work with him closely in community affairs and public service areas. I request him to introduce Dr. Varun Jeph. Following his introduction, we'll have Indian National Anthem as part of protocol because Dr. Varun Jeph, Deputy Consul General of India, is on call to speak to us. And right after Indian National Anthem, he will bring his address as part of inauguration. Daniel Rajaya.
Fantastic. Thank you, Uncle, and congratulations to you and the entire leadership of Global Grace Health on this 3rd anniversary. It's truly a remarkable journey that you've all been on, and it's been a joy to be part of it and to watch all of you and this team work together to do so much of an impact and good work in India, especially around cancer and all the tremendous work in healthcare that the organization is doing. So my hearty congratulations to you, Uncle, and to the entire team. It's great. It's now a great honor and pleasure to introduce you to my dear mentor and friend, Dr. Varun Jeph. Dr. Varun Jeph is a medical graduate. He is a career diplomat with over a decade of experience in the Indian Foreign Service. He has served in different capacities in the Indian Embassy in Myanmar, in the Indian High Commission in Malaysia. In between his overseas assignments, Dr. Varun Jeph served in New Delhi at the Ministry of External Affairs and was involved in administration and human resources management of Indian Diplomatic Corp. He joined the Consul General of India in New York in September of 2021. Let me also say on a more personal note that it's not very often that we have someone who has a tremendous brilliance like Dr. Jeph, a medical background, foreign experience in so many different foreign posts, who has a tremendous impact on foreign policy through the work that he's been granted. So Dr. Jeph, it's a pleasure to welcome you and to have you join us on behalf of Dr. Paturi, the Global Grace Health Board, and the entire team here. We're very excited to have you join us today and to hear what you have to share with us.
Thank you, Daniel. You've been as kind as you always are. Dr. Joseph Paturi, President of Global Grace Health, Dr. Madhu Kandarpa, the renowned nephrologist. Thank you, Daniel, for such a kind introduction. Dr. Paturi, Dr. Kandarpa, a renowned nephrologist, members and patron of Global Grace Health, ladies and gentlemen, a very warm namaskar to all of you. Dr. Varun Jeph, I'm the Deputy Consul General of India, and it is a great delight for me to join you all, distinguished physicians, philanthropists, compassionate individuals who are committed, who are dedicated to advancing the health and the well-being across the globe. As I understand, your operations are not only in India, but they span across the world in all 6 inhabitable or 5 inhabitable continents. And you are taking your health technology, you are taking health screening, and you are taking healthcare services to people who are not yet touched by them and people who need it the most. And for that reason, given the noble cause that you are all involved in, and given my own background from medicine, it is indeed my privilege to be associated with today's event. Friends, it is also a special moment for all of us, particularly those from India, for it happens to be just a day after we celebrated the 75th Republic Day of India. Last 2 years, we were celebrating 75 years of India's independence, what we have been calling Azadi Ka Amrit Mahotsav. And now, as India embarks on its journey into Amrit Kal 2047, when we would be celebrating the centennial anniversary of our freedom, we seek all your support. A few months back, in June of 2023, we saw a historic state visit of the Prime Minister. Prime Minister Modi was here. The way the ceremonial aspects were handled, the substance that came out from the joint working group, it was then followed by President Biden's visit to India for G20 presidency, which India was hosting for the year 2023. I mean, it was a remarkable year for Indo-US partnership. It brought the two countries closer. And if I were to use President Biden's words, the relationship today are more close and more dynamic than they've ever been at any point in time. It is a relationship that spans and that covers every aspect of human endeavor. And now, to quote my Prime Minister, it covers all areas from the depth of the seas to the heights of the sky. And today, I have the privilege of joining you all for the third Global Grace Health, my second time with you all. And for that, this occasion is much, much more special for me. So I would like to thank Ms. Dr. Paturi. I would like to thank my friend, Mr. Daniel Rojaya, for the gracious invitation. I'm truly honored by your invitation and by being given a chance to join you all here. I would leave the medical expertise to the experts who have joined us today. I would just like to touch upon a few things and few data points that are coming out of India in the last 10 years. 2013, India was counted among the fragile 5 economies of the world. Today, we are the fastest growing major economy. Last year, we overtook the United Kingdom to emerge as the 5th largest economy in the world. We were the largest democracy, but now with 1.4 billion people, we are also the largest demography on the planet. And what's most striking about it is that the median age of our country is 28 years, which means it's a very young demography, it is a talented demography, and the future belongs to this cohort. We also have now the third largest startup ecosystem in the world. From merely 500 startups in 2013-2014, today India boasts of about 110,000 startups, out of which about 120 have already achieved the status of a unicorn. Just 2 days back, we have also overtaken Hong Kong as the world's 4th largest stock market. And you all know the success story of India when it comes to real-time digital transactions. In 1 month, India does about 11 billion digital transactions, which is more than twice of what United States and China do combined. So you all, whenever you travel to India, you would see that transformation yourself, because whenever you go to a vendor, to a shop, and you try to pay them cash, they would ask you to make payment via QR code or through an app. And to top it all, we had Chandrayaan landing last year. India became the only country in the world to have landed on the south pole of moon. So the next full moon, when you look at the moon with your telescope, you would find it different because the moon would have an imprint of India on it. To add to all of this, we have 500 million new bank accounts opened in just last 8 to 9 years. Add to that, about 110 million tap connections, 100 million houses being built in rural India, 100 million LPG cylinders being given to ladies to cook, which has changed and totally transformed the way rural India operates. We are in the midst of doctors, so let me tell you that India now also has the world's largest public health insurance scheme, what we call Ayushman Bharat, which gives insurance to about 500 million people. That is more than the population of the United States. And this transformation and this dynamism is not just restricted to India. It is also translated in our partnership with the United States. The areas of technology, for example, something that many of you are involved in, AI, machine learning, 5G, Internet of Things, quantum computing. So that are at the focus of our partnership between the two countries. Economic and commercial relations. Our trade with the United States, it's been the highest that it has ever been between our two countries. We have thriving and flowing bilateral investments, both from United States to India, but also importantly from India into United States, generating thousands of jobs here and creating new facilities. The Indian students, they make for the highest cohort of international students now coming to United States for second year in a row. Currently, we have about 300,000 students studying across the United States in different universities. We in New York Consulate, we cover 10 states in the northeastern part of the United States, right from Ohio to in the west to Maine in the east. And of these 300,000 students, more than 100,000 students are in our jurisdiction. And we are very proud of the value that they bring to the American economic, talent, and technological ecosystem. We are working very closely, our two sides are working very closely on the energy and green hydrogen and battery technology. And defense cooperation is something that we all saw with the US transferring the engine technology to India, the collaboration of GE with Hindustan Aeronautics Limited. India is the only country in the world with which United States has such an agreement, has such a collaboration and cooperation. So you would get an understanding of the relationship, the strength, the dynamism that we are talking about. I mentioned to you a few of the sectors that are at our focus, but there is no sector that reflects the people and development-oriented nature so vividly, so strongly as the healthcare sector does. And we all saw this very, very startlingly during COVID. And what COVID taught us is that health is our real wealth. Be it securing our critical supply chains, be it vaccine procuring, be it masks, drugs, PPEs, be it our digital health platform, CoWIN, that was used in India to give appointments for vaccines, be it developing vaccines themselves. Many of you would know that rotavirus vaccine, which was built or developed jointly by India and the United States, it used to cost $60 per vial. But after the two sides came together to jointly develop it and then to manufacture it in India, the cost of each vial came from $60 to just $1. And similarly for COVID, we have jointly developed at least 3 vaccines, Corbevax, Covovax, and also now J&J, 1 billion doses of this vaccine, Johnson & Johnson vaccine, are being manufactured in India to supply 1 billion people across the Southeast Asia, the Indo-Pacific region. We saw exchanges of best practices between our two sides, and our scientists, our physicians, they played exemplary role in getting not just India and the United States, but the entire world out of the grip of COVID pandemic. And for that, we are very thankful to all of you. We are joined by a number of physicians on this call. So just a data point, we have 4.5 million people of Indian origin spread across United States. You reflect 1.2% of United States population. But it is this population that contributes to 6% of total taxes that the United States government generates. 10% of the total doctors in the United States trace their roots to India. But you also pitch beyond your weight and above your weight. For every 1 in every 7 patients in the United States is touched by an Indian doctor. Friends, these are not merely numbers, but these are splendid achievements by our diaspora, by the physicians, which no other community can boast of. And for that, this is something that we take great pride in. And this recognition and appreciation is not just coming from me, representing India and the United States, but let me tell you, this is a prominent talking point whenever we talk to the United States interlocutors, be it politicians, be it the business leaders, be it healthcare leaders. It is a point that comes from them to us and not from us telling them. So your achievements, your accomplishments are well recognized here in the United States. They are very, very well appreciated. And the United States government is also very grateful and very thankful for all that you do. Healthcare is a sector that brings together power, brings together the knowledge, and it brings together heart. All three come together. And when we talk of Global Grace Health, you are making exemplary contribution in this field. You are spreading awareness about healthful living. You are spreading awareness about well-being, be it through your cancer runs, be it through your cancer screening mobile vans that go out, or the vaccination drives that you all do. You personify the Indian philosophy of Vasudhaiva Kutumbakam, world is one family. That was also reflected in our G20 presidency motto, which was one earth, one family, one future. And you recognized it not today, but a couple of years back, that it is not just by treating people here in United States or just in one part of the world, but across the world, spreading more awareness about how to live healthy, how to focus on both physical health and mental health, that you are contributing so much to building a healthy world, building a healthy society. And for that, I once again extend our deepest appreciation for the good work that Global Grace Health has been doing. Our best wishes to the entire team of Global Grace Health. May you all continue to work and be committed with the same energy, zeal, resolve to make it a healthy world out there for us, for everybody. With those words, I would like to thank you all once again for giving me this opportunity. I wish you all a good day and a great year ahead. Thank you.
Thank you, Dr. Dr. Varun Jeph. It is so motivating, so encouraging to us to know how India is growing. These numbers we hear here and there, but it is so concise and complete to understand the growth of India from where we went from the depth of the seas to the heights of the skies. That is so wonderful to hear. And we, GGH, we are very happy to be part of this Vasudhaiva Kutumbam, as you said, and we will continue to support and will continue to contribute to the growth of India, to the health of India. And we would like to see healthy India. That's how GGH is contributing and going into the rural areas to support and give vaccines and take the preventive care. Thank you very much for joining today. And we are so grateful for you, for your time and the great inspiring speech. And we are so proud of our country, coming back from the Indian background. We are so proud of the country, the growth that we see now. Thank you very much one more time, Dr. Varun Joseph. It's so kind of you.
Thank you.
Thank you. Now I invite Varun Jeph, our Executive Director, to continue the program and present GGH Impact.
Thank you very much, Suresh. Thank you, Dr. Varun Jeph. We have created this model with India being the framework, and we had the backbone there. Our desire is to take it worldwide, whatever the impact that we were able to, with the help of our partnership with Grace Cancer Foundation, we would like to take it worldwide. Thank you, Dr. Jeph, again. Our vision for Global Grace Health is that we wanted to have new approaches and initiatives to move forward the healthcare industry around the globe. Started a boiler template in India, and our job is to take it to or extend it to other countries and continents as well. Our mission is to advance health, hygiene, and wellness globally through education, awareness, scientific research, and technology and innovative methodologies. And our beginnings, a few of us looking at the opportunity that we have through Grace Cancer Foundation in India, we have been supporting it outside of it from United States here. But then we had a desire to extend it beyond. And a team of us discussed about and formed in 2020 and registered the nonprofit organized in United States in January of 2021. We received a tax exemption from IRS the same year. And our objectives, I'm not going to read everything here, but to bring awareness about preventive health, predicting lifestyle diseases, serve as a personalized, customized lifestyle coach, and there are so many things with the sheer power of our people on the ground working through day and night in these cancer screening camps. We are willing to take it further and and our objectives we are planning to achieve one by one. And here is our GGH founding members and the board. Dr. Joseph Paturi, who is our president. He's from Ohio, and he's been a mentor for all of us. And Dr. Chinnababu Sunkavalli, who is sheer force behind Grace Cancer Foundation, but also is a board of director here with us in Global Grace Health. Mr. Chandu Tota is also a member at large and has been a great supporter through his organization. Dr. Kiran Avancha is our vice president and joint treasurer from Arizona. And I am here in Raleigh, North Carolina. And Mr. Suresh Bandugula is the director of our institutional advancements in Philadelphia, USA. Also has supported us through PTA and other organizations in Philadelphia area, and taking it to the next level to get the support from many other organizations of Indian origin as well. Our US regional directors from Northeast, we have Sri Amirshetty from Pennsylvania. He has roped in his organization to support us and directly went to India and also witnessed personally about some of the work that is being done. Mr. Murli Pasmati from Massachusetts, and who is our great supporter and also conducted runs in the last couple of years. Mr. Vindhya Garapati from New Jersey is also very active with Thana and received direct support from Thana, and which you will hear soon. And he's been a great supporter for us as well. And John Sunkavalli from New York, and a good cricket player, and also ropes in his cricket teams to support us in the cause as well. And regional directors from North Central, again, Dr. Joseph Paturi, take care of from Ohio, and Mr. Adam Kolifara from Michigan. He has been a great support from the school that he works in, the band that he works in, and another Taekwondo institute that his brother works in as well. He's been a great supporter and a regional director from Michigan. South Atlantic, we have Mr. Das Chebatini from Washington, D.C. area, Maryland, and Virginia area. He has conducted a couple of Grace Cancer screening camps. Then he also brings in a lot of support from his employer, but also from the other areas that you will hear from him shortly. Mr. Deva Veeraswamy from Texas, and Mr. John Spurgeon from Tennessee used to be, and back in India now, and is a great supporter for us. Mr. Emmanuel Rampa from North Carolina, and Mr. Subbu Mankonda from Texas, who is also our director for Global Grace Cancer Run too. He has been a great inspiration for us running marathons himself, but also roping in a lot of people in Texas, a lot of supporters from Texas, one of the huge number of supporters there. And our regional directors at the West, Dr. Kiran Avancha from Arizona is also on the board, Mr. Babu Peter from Utah, and Mr. Sunil Magadati from Colorado, who also supported from day one. And he has been a unique force and was able to gather support from the students and through his a very good initiative, teaching as well as seeking the support to Mr. Clement Lavu from Colorado, and Mr. Chandu Thot, as I explained, from California, is a great supporter for us from the West. And international from Africa, we have Dr. Ajiboye. You'll also hear from him briefly in our reflections, and he has been a great support, bringing in a lot of countries together in cancer awareness run. From international and the Australia area, New Zealand area, we have Mr. Nagbhairava and Dr. Ravi Musku supporting us from that region. And from Europe, we have Ms. Sonia Chada-Nihal and Mr. Peter Samuel supporting us in the cancer run. And also from Central and South America, we have Ms. Paulina Risco supporting us from the Central and South America. International from Asia, through our Grace Cancer Foundation, I Mr. B.L. Sujata Rao Garu, who is one of the founding members for Grace Cancer Foundation, Dr. Chinababu Sunkavalli, and Dr. Pramila Rani, Dr. Hemant Udayaraju, and Dr. Kiran Avancha, also supporting Grace Cancer Foundation in their board. GGH impact through Grace Cancer Foundation from last 3 years has been, we have reached around 20,000 lives with volunteers over 600 and having the global Grace Cancer Run in 130 countries. We had around 200 total events, and during the COVID pandemic, the year when we started, because of the pandemic aspects, and we quickly worked with the different organizations and gathered support and provided 1 million masks, surgical masks, and 325 ventilators, and 265 medical grade oxygen concentrators. And we also supported a institute with the 2 dialysis machines, and we did support around 5,000 vaccinations from here related to COVID. And we conduct online webinars and in-person meetings to educate our supporters and different areas where we have people gathered for, and conduct these awareness sessions. And in education, we also at the Grace Cancer Foundation, we received Guinness World Records of largest cervical cancer awareness event. And Global Grace Cancer Run in USA this year was in Dallas, New Jersey. Last 3 years, New Jersey, San Francisco, Colorado, Chicago, Detroit, Houston, Raleigh, Boston, and Washington in the DMV area, Delaware, Maryland, and Virginia areas. Global Grace Cancer Run International, we have it several different countries. And the countries wise, you have seen the numbers here. We cover North and Central America, South America, Africa, Asia, Europe, and Australia, and New Zealand, and other areas around. Fundraiser cricket tournament was conducted this year in Raleigh. Almost 12 teams have formed very quickly, and over a long weekend. Irrespective of the rain, they did play. We had the women and men's teams, and they have participated in our cancer awareness event, also played for fun as well. We have 6 state-of-the-art cancer screening buses at Grace Cancer Foundation that we support from here. In the last 3 years, we have supported 20,000 screenings, mainly in Telangana and Andhra Pradesh area, which we are planning to increase that reach shortly here. We are able to achieve this with great support from these organizations. You have already heard those names. I'm not going to repeat, but thank you all the supporters. The road ahead for us. This year, we wanted to achieve 25,000 screenings, including a special project in Odisha that I'm going to speak about soon. And having AML, app for detection, data for research, and paperless screening, prevention awareness drive in 130 countries and reaching 1+ million people in the years forward, and lifestyle coaching. In Grace Cancer Run 2024, wanted to target at least 15+ locations in the USA alone. And cancer vaccination, HPV vaccine, cervical cancer-free campaigns also is in one of our agenda and the road ahead. The Odisha special project, we have received a special request to conduct camps in the cancer screening camps in the Paharpur area to impact about 50,000 lives in the tribal and backward communities who do not have the privilege of having a cancer screening. So GGH Global Grace Health will be a financial partner, and Grace Cancer Foundation will be implementing partner, going with the buses there and putting a camp and will be doing the screenings. And the project 25K screenings, we wanted to impact, if anyone wanted to impact 100 lives, the cost of it is around $1,000. and impacting of 1,000 lives is like $10,000. Screening can be held at a place of your choice or our choice. Currently, we are primarily set up in Telangana and Andhra Pradesh within India, but we've also went to neighboring states, be it Karnataka, Maharashtra, and Odisha and Chhattisgarh as well. But if there is a special region that you wanted to focus, we are willing to expand this upon as well. To help us raise funds, you can get someone screened, get your village screened if you have a special affiliation or affection to one of the village or some rural area. Do let us know, and we will be willing to partner with you to go to that village and get the village people scanned there as well. And sometimes it's also happened that some of the corporates come forward and provide this as a benefit to their employees. There's something like that back in India, so we would be willing to work with you as well. Now I'm going to play a small video.
Hello everyone, my name is Sunil Mogadati from Denver, Colorado. I'm one of the regional directors from this region. Through GGH, we have conducted the Global Grace Cancer Run, the 5K run here in Denver for the past 2 years. We have obtained corporate sponsorship from Emerge Tech Business Solutions to conduct those runs. In addition, we have also done some fundraising to help with medical camps and screening camps in India. One of the ways we have done the fundraising is to conduct some technology-based classes to help with students who are just entering the workplace, to help them with technology trainings, as well as to help them prepare for workplace success, as well as success in their life ahead. Because one of the core beliefs we have is that the purpose of our existence is to serve one another and to collectively work towards human flourishing and human development. I'm thankful to GGH to provide that opportunity and to engage with the community in a positive way. And thank you, everyone.
Hi, everybody. Thanks for joining us for our 3rd anniversary celebration of Global Grace Health. My name is Adam Kolapara, and I'm a regional director here in Michigan, United States. And I'm happy to have been a part of this organization and team for the past 2 years. Since then, I've been able to host 2 of the Global Grace Cancer runs in the Detroit area. And those runs have been supported by Northville High School Bands, which I am the percussion instructor, as well as the assistant marching band director for, and also the Michigan Academy of Taekwondo, where one of my brothers is an instructor there. So we were able to, with the help of students at both those institutions, to put on these runs and raise funds and awareness for the cause. So I'm only looking forward to what we have in store for the coming years for Global Grace Health, and thank you all for your continued efforts and contributions.
Hello all, I am Das Chebatna. I'm the Regional Director for the Greater Washington DC area. The past 3 years have been an incredible journey for GGH, and it is made possible only through contributions from valued partnerships like yours. And I would like to outline some avenues for partnering with GGH for financial contributions. We have implemented corporate matching program like Benevity with the Fannie Mae, which is a $to-dollar matching initiative. And we have a similar program through Bright Funds also. Of course, you can help us in registering GGH for similar initiatives in your organizations too. GGH is also registered with CFC Giving. It's an official workplace giving campaign for federal employees and retirees in the US federal agencies. We are thankful to corporate sponsorships like Google, a big supporter for the GGH, Bridge Gap Hospitals, Smart IMS and Lucidus Solutions, and of course many other organizations who have sponsored cancer runs in the US and also cancer screening camps in India. If you or your organization is interested in joining hands with us in this movement, please consider sponsoring events like this. For individuals, you can make online contributions through PayPal, Zelle, and of course you can transfer directly to the bank through checks and online transfers too. We're looking forward for more partnerships through these avenues that we have and work together with you all. Thank you so much.
Hello everyone, my name is Vidyadhar Garapati. I am one of the regional directors for Global Grace Health, an extension organization of Grace Cancer Foundation. Also, I am Thana Foundation trustee, and I want to congratulate all GGH team for 3rd anniversary and also be able to successfully conduct hundreds of cancer screening camps in India to touch unprivileged people across the rural and also urban part of India and make a difference of those people who are not having access to cancer screening and cancer awareness. And especially myself, last 2 years, we were able to conduct more than 100 camps, cancer screening camps, and we were able to touch more than 100,000 people, and we were able to make a difference in their lives. Once again, congratulations, GGH and Grace Cancer Foundation.
The Grace Health Run has proven to be transformational in Africa. 3 years ago, we were in Guinea-Bissau, all over Nigeria, some representative in northern Ethiopia, and various other countries of Africa, Central African Republic, Togo, and so on and so forth. The same thing in the year that followed. And finally last year, due to certain exigencies, we concentrated mainly on Ghana, where a lot of young people spent a whole day trying to create awareness in communities. Now, we thank those who have provided leadership for this movement. It has gone beyond just one day into a systemic proposition which is causing many ministries to arise all over Africa. Congratulations on the 3rd anniversary. My name is Dr. Oluwaseyo Ajiboye.
Thank you, our regional directors, and these are our reflections from a few of them. How can we partnerships for research through technology, education, and screening? Some of the ways that I had mentioned earlier. And the ways to donate, as Mr. Das Shebatini mentioned, we do it through PayPal, Zelle, and GoFunds, or the direct checks or banks, and corporate matching programs and federal giving as well. If any of your organizations are part of these corporate matchings, or if you have a separate matching program, do let us know, and we are willing to work with you. At this time, I would like to give it back to Suresh.
Thank you, Varma. It's so nice to bring these reflections to us one more time, reminding the great work that we are doing across the globe as GGH and GCF, touching many people's life. And we encourage everyone to participate in the capacity that you can through GGH and GCF. Your might and might both would help in touching many people's life. Now I request Dr. Joseph Porturigara, our chairman, to introduce our keynote speaker.
Now it is my pleasure and privilege to introduce our keynote speaker, Dr. Madhu Kandarpa. He is a leading nephrology specialist in Dayton, Ohio area. He is well experienced and well credentialed with MD, MRCP from United Kingdom, and from here in the US, Fellow of American Society of Nephrology. Now may I request Dr. Madhu Kandarpa to bring his keynote address.
Thank you so much, Joseph Garu. Good morning, everyone. Congratulations, GGH, for excellent work, and privileged to be part of this. And I'm always available for anything I can do from my end. Dr. Beatty asked me to do this a couple of days ago, and she has some emergency. And I was not even sure what exactly it was. I just agreed to do it, and thought of I'm happy to. So the topic I would like to, I thought of choosing for this particular occasion is an upcoming clinical syndrome. It's called syndrome, but actually, for a positive note, everyone is calling it as health, CKM health. This is kind of a global initiative to promote and to bring some kind of patient-centered holistic approach for the problem. The problem, or we can also call that as elephant in the room, is obesity and overweight. And as we all know, that is a global epidemic as well as a growing problem, and which is a huge burden to the healthcare across the globe. So there are various specialties in the primary care physicians and the public services trying to address this problem. And, you know, as we go back, it was, next slide, please. So as you can see here, the number is growing, and you know, in the numbers in the United States, in India and China, maybe because of the population partly, but the number of people who are overweight or obese are crossing like 20 millions. And it's a growing number. And as you see, India is in the second place from that standpoint. Next slide, please. So what is CKM syndrome? It's basically cardiovascular kidney metabolic syndrome. As we all know, metabolic syndrome is well known, which is a syndrome called excess abdominal fat, hypertriglyceridemia, low high density lipoproteins, elevated blood sugar, and elevated blood pressure. It's all, you know, they're all like individual problems, but the source of the all of them is pretty much being overweight or obese. And that's how they're put together, and the pathology behind those is also pretty much the same. So how CKM syndrome is different from that is, it is actually taking one step forward and putting all the end organ damage issues as well as major organ involvement, putting it together into one big syndrome or a group. It's kind of a newly developed medical condition, or is kind of a syndrome which was developed recently. There has been tremendous work from across Johns Hopkins and several other places about this. So what it basically means is cardiovascular, which includes effect on the heart, blood vessels, kidney disease, chronic kidney disease, gout, and other medical conditions. A metabolic, which they put together like, you know, type 2 diabetes mellitus and obesity. As you can see, it is affecting like 1 in 3 American adults. It's almost the same even in India. Don't know the exact numbers, but I'm pretty sure it's almost close to that. So how do they present? I mean, the presentations are quite wide. They could present with chest pain because of the ischemic heart disease in an advanced stage, shortness of breath from the heart failure or from the myocardial infarction or angina. Sometimes they could present like a syncope or a stroke, you know, or swelling in the legs, hands, and feet, which is pretty because of the heart failure, kidney failure, or liver failure. And some patients may present with difficulty in walking because of the peripheral arterial disease. It could just be a symptom like a tiredness because of either general health problems, weight, or exercise intolerance, or general, diabetes issues, all kinds of things. Interestingly, they could present either with a loss of appetite or increased appetite. Looking at metabolic syndrome with overweight and obesity, but still loss of appetite could be a presentation in this group of patients. And need to urinate often is another symptom typically seen because of the high blood glucose, or could be from the kidney disease or from heart failure. And sleep apnea, as we all know, is well known because of obesity, and even it's in morbidly obese patients, it's much more common. Gout is, crystal deposits because of the metabolic disorder, usually associated with a chronic kidney disease. As we look going back, basically the pathology of this condition pretty much the same as metabolic syndrome. Excess body fat or adipose tissue, it causes cardiovascular kidney metabolic syndrome. What it basically means is the fat releases substances that causes inflammation. It could also be kind of oxidative stress, so-called oxidative stress, and it causes damage to heart, kidneys, and arteries. It is indirectly related or directly related, causing high blood pressure, diabetes, joint disease, and skin disease, and all kinds of things. So when we look at what are the risk factors for metabolic syndrome or CKM syndrome, is we could call them risk factors, or we could also call them part of the syndrome, like obesity. The main risk factors are excess body fat around the waist, high cholesterol, especially LDL, and hypertension or high blood pressure. Kidney disease, like a chronic kidney disease of various stages, or chronic kidney disease because of diabetes affecting the kidneys or hypertension affecting the kidneys. And again, metabolic syndrome could just be part of some of those factors of metabolic syndrome could be making the whole picture worse. So basically, how do they present? They all present pretty much the same at the end, like heart attack, strokes, or heart failure, cardiac arrhythmias, or could also be like chronic kidney disease, advanced or end-stage kidney disease. Could also be presenting with a peripheral gangrene and other end organ damages, or even liver failure causing non-alcoholic cirrhosis of the liver and other conditions. So basically, what is the whole idea is to see, all these problems, patients go to the doctors and for different things, like could be going to the primary care doctor, screening for the weight. Oh, your weight is high, you're overweight, let's do some exercise. And then you say, okay, you have blood pressure, let me give you a medication. Or you have diabetes, or you have pre-diabetes, and checking all those kinds of things. And but and then they go to a cardiologist and say, hey, you have some EKG changes on your notice, and let me do a cardiac cath. And then they go to a diabetic specialist if they're diabetics, and then they take care of all the diabetic issues. But there is no real holistic approach, and patient, it's not like a patient feels, okay, I have several hundred medical problems. What can I do about this? Kind of situation. Sometimes they go to the primary care doctor, they give a diet sheet for losing weight. Then they go to endocrinologist, they give a diet sheet for diabetes. And then they go to nephrologist, they give a diet sheet for low urine diet for the gout or chronic kidney disease. So they end up with 4 or 5 different diet sheet, different recommendations. and they don't know what to follow, and whether if you put all of them together, they kind of causes a panic situation. So by bringing the whole picture together as CKM syndrome, the idea is to bring all specialists together, patient-centered approach, and then to put all the diet sheet or recommendations or whatever they want to do as a one central recommendation, and the patient being the center of the whole problem, rather than trying to puts lots of bandages, or kind of a collaborative collective approach, team approach. That's the whole idea. And this is actually going to revolutionize, I feel, and many experts agree with that, saying the whole CKM syndrome, if it is divided into like 5 stages. Next slide, please. So we can see in the picture, if stage 0 is basically those who don't have any problem, they are at the optimal weight, no medical problems, they're stage 0. And then they could be advised to keep the healthy lifestyle, and depending upon the family history, to address those issues. And as you see, if they are in stage 1, those are the problems mostly to do with the pre-diabetic situation or overweight issues, and they're almost heading towards developing further cardiovascular and neurological and kidney-related health problems in the lung. Then stage 2 is you already have high blood pressure, diabetes, and peripheral vascular disease and other conditions. And as you can see, stage 4 is the time when they have so many risk factors, and the cardiologist wondering about doing calcium score, whether they need any further stress test or any those kind of things. As you see in stage 5, they have already have end organ damage or end stage heart disease, kidney disease, or stroke and its effect. The thing is about it's not. It is the staging is bidirectional. The encouraging part of that is by putting it together, you can see where the patient, like a kind of a snapshot, which group the patient is belonging to. And it's a bidirectional. For example, someone is in stage 1, and with all the available medical treatments, as well as lifestyle changes, exercise, and all kinds of things, they could go to stage 0. So basically, that's the kind of approach. If someone is presenting in stage 3 and they get all the medical necessary treatments, nowadays we have so many advanced medical medications available, like SGLT2 inhibitors and several other medications. They could reverse or slow down the process. So even if someone presents in stage 3 or stage 4, they could still go back to stage 2, or at least, or even stage 1, with proper care and multidisciplinary approach. That's the whole idea of putting all of them together into kind of a one syndrome and staging. The beauty of this is you're not calling anyone like discouraging or causing any kind of thing. It's kind of a positive thing. Anyone actually, obesity and overweight are problems even in the pediatric group nowadays. So the screening could be started to put them into what stage they are in, even at the age of 5 years or 3 years. And then they know, okay, this person or is at this stage, so let's address the problems ahead of time, so that everyone, the goal is to everyone could be in stage 0 eventually. That is the inspirational approach, rather than majority of the times, as I see chronic kidney disease pretty advanced. They had like 20 years of diabetes or hypertension. All I could do at that point is to maintain their health, or to delay their onset of dialysis, and while their heart problems are getting advanced. So that's the whole idea. I thought of this would be a very way of approaching, would be game changer in the current situation. Like, we all know about the healthy eating, all those things, but never probably properly focused in a focused way, followed by the patients or as well as recommendation. Just give a, hey, you need to lose some weight. Here is the diet sheet, but nothing happens at that point. So by saying, okay, you're in stage 1, if you do these things and we all work together, we can be in stage 0 and we could be in a much better health. That's the whole idea of putting all these things together. And I think this could be a kind of a screening program, like you can go and do a screening program to see what stage of CKM's health. You can, rather than calling that as a syndrome, even though I said syndrome, but CKM health could be a screening tool which can be used across and see, then properly direct them for further care. That's all. So I'll stop there, and if you have any questions or comments, I'd like to take them.
That's great. Thank you, Dr. Kandarappa. This is really a great, and it is an eye-opener to understand, to know how the CKM is spreading and causing issues in the common man health life. And thank you for sharing the causes, the symptoms, and the prevention. Most of it surrounding on the lifestyle, I believe. If we have a healthy lifestyle, and we will avoid all these things. We are grateful, even GGH along with GCF trains on lifestyle training, and we will take these notes and keep it as our part of the program to have a healthy lifestyle to prevent this CKM syndrome. Thank you very much, Doctor. We have at least 1 or 2 questions. The first question is, I would like to, is intermittent fasting a good way to deal with metabolic syndrome?
Yes, intermittent fasting has been, it is coming now, is becoming more and more popular. Actually, if you go back to ancient Indian history, intermittent fasting has always been in Indian culture. Going back hundreds and thousands of years back, always been a recommendation to do intermittent fasting every 2 weeks. They call Tidhi Ekadasi, Istu Ekadasi fasting, which has been scientifically proven to be beneficial in kind of resetting the body, and it helps to fight oxidative stress and resetting gastrointestinal system and even renal system, cardiovascular system, and so many other benefits. But the term is kind of a vague, I would say, so it has to be properly structured. Nowadays, there are recommendations based on age of the patient and their health issues, how the intermittent fasting should be done. I think, but definitely intermittent fasting plays a major role in addressing CKM syndrome.
Excellent. Thank you, Doctor. Are there any other questions? If someone would like to ask, if you're unable to type, we'll give an opportunity to ask directly for a minute or 2, keeping time in view. Next question, Doctor. Can diabetic person take protein every day?
Yes, in a short. Diabetic, usually the restriction for diabetic patients is mostly about kind of a simple sugars, and protein is always beneficial, saying that if they have chronic kidney disease or stage 3 or stage 4, there could be need for some protein restriction. Not that they should avoid protein, but there's some kind of a restriction in how much they can take in a day. But overall, there's no major issue with the diabetes or kidney disease for taking any protein.
Thank you, Doctor. Karen, I believe you got the answer. One more question we have is, Doctor, what is your opinion about Dr. O's gummy, Dr. O's gummy pill, which will cure diabetics the way they promote?
I'm not a believer in any kind of a quick fix or band-aid. I think the fundamental problem is to look at the lifestyle, and nothing beats the fresh food and regular exercise and good night's sleep. I think that's the best way to address any kind of these kind of problems. I do not believe. I know there are several medications, but I do not believe any kind of a quick fix medications.
Thank you, doctor. Thank you very much for answering our questions, and we will like to stop here. If anyone have questions, please send in the chat. We will take it offline and we'll send it. Now I request our chairman, Dr. Joseph Paturi Garu, to introduce our special speaker, special guest.
Thank you, Suresh Garu. Thank you again, indeed, Dr. Madhu Kandarpa Garu, for coming at such a short notice, as Dr. Surmit Bedi could not make it today. But thank you for accommodating and coming on and speaking to our group today. Thank you so much. Now at this time, it's my special privilege and honor to introduce Dr. Alok Agarwal. He is also a very experienced and a leading nephrology and clinical hypertension specialist in Dayton, Ohio area. He has extensive experience and excellent credentials with MD, FAS, SN, and FNKF. May I request Dr. Alok Agarwal to come on and speak from his heart, sharing his vision and passion, as he does a lot of philanthropic work to transform societies, villages, village by village, particularly in India and more so in South India. Dr. Alok.
Thank you, Dr. Joseph. First of all, I must apologize. I have another program, so I'm running late. I have to leave by 12:15 or so. Dr. Paturi, how do I share my slides? I have it here with me.
You can share.
Madhu, great presentation. Congratulations. Congratulations to the whole group, all of you. The great team is great. So share screen.
Hey, Alok, thank you.
Yeah.
Praveen, you can share screen. Dr. Alok.
IRD. Okay, here. So once again, congratulations to the entire group. Can you all see the slides?
Yes.
Yes.
Okay. So I'll finish in 1 or 2 minutes, and hopefully we can, next time I can join you all to share the experience. But I am envisioning developed India through integrated rural development model, and we actually adopted a cluster of 10 villages in Telangana. My work is, it has also helped me transform my own life. It involves compassion, dignity, equality, perseverance, patience, progress, peace, beyond all kinds of divides. So the flagship program is in 10 villages of about 6,000 people. And, some of these programs have spread to neighboring villages in Telangana and also Kottagudam area, Adilabad, about 500 villages, and then another 500 villages across India. So mostly the work is in education, healthcare, women empowerment, youth employment, infrastructure improvement, community participation, agriculture development. So it's sort of holistic work. In education, I'll skip the slides. I'll come to the healthcare right away in the interest of time. I'm very much interested in preventive healthcare, actually. And this is Smiles program, which talks about sanitation, maternal and child care, immunization, lifestyle modification. We just spoke about lifestyle modification, education of masses, and screening. Thank you very much.
Thank you, Dr.
Thank you, Dr. Alok. I know it was a last minute invite, but you made it and gave us the great work that you are doing as part of Pragati Foundation. It's an inspiring and encouraging for all of us to do. And we hope to partner with you in future to do great work in that region.
I've heard about all of you. Great presentations, great work. Thank you very much.
Thank you.
Congratulations.
Thank you, Dr. Alok. Friends, I just wanted to give a quick note about the Orissa screening campaign that Verma mentioned in his reflections on GGH impact. This request conduct screening camp in Orissa is coming from SLS Trust. So through SLS Trust, we would like to do this campaign, screening campaign in Orissa. Now, I request our member at large, Dr. Chandu Tota, Vice President Google, man behind our navigation that we are using. He is not only helping the world to navigate, but he is also helping us to navigate in global grace health in various capacities, either raising in funds or, meeting people, encouraging them. And I request Ms. Chandu Tota to release the book that Dr. Chinababu has told to Dr. Agarwal.
Thank you, Suresh Garu. Can you folks hear me?
Yep.
Yeah. So it's great to be here. Thanks for having me, and Joseph Garu and Dr. Verma, congratulations. I can't believe it's already a third year. And more importantly, I think, I'm so proud to see all the impact that the whole GRACE team is driving, both in the US, but also in India, in close partnership with GCF. When Chinna asked me to release the book, of course, I have to read the book. So I picked up the copy when I was recently in India, and on my way back here, I read the book. And I think, the most important thing for me is, as an engineer and as a person who thinks about systems and creating more efficiencies day in, day out, if somebody tells me that there is a way to create something everlasting from something so temporary, meaning that creating more from less, I would actually question their sanity, because in physics, it's simply not possible. But when it comes to life, I think, reading this book kind of opened my eyes, because life itself is temporary, but what you do with it can create a lasting impact, and that is a legacy. So the title of the book kind of gives away the secret sauce of how to create more with less, or how to create something everlasting with so temporary. And then reading through the story of Dr. Chinna and his journey, and also the incredible impact that he is having through his work as a robotic surgeon, but also through his foundation in touching so many lives across India and across the world is just an incredible story. And it's so inspiring that recently when I was in India, I also hosted both Dr. Chinna and Professor Arun Tiwari at Google. And I remember Professor Tiwari talking about, demystifying the big word of legacy for all of us. There were a number of engineers in attended that session. And because for us, most of us, legacy is a baffling word. Like, it feels like, oh my God, I'm just a mere mortal. How do I think of legacy? And Dr. Tiwari's definition was so simple. And it is something that I think, we all can do. He said something along the lines of, you wake up every day, think about your day and how you can add that delta X in your life. And that delta X can be something you are doing at your work. That delta X can be something that you are helping others. And that delta X can be like curing cancer. And that delta X can be leading a nation, right? So thinking about that delta X within your own context and thinking about that as an incremental add to the legacy that you are going to leave in your life, I think is such a a simple way of thinking about this powerful concept. So it's my honor and privilege to really launch this book on this occasion. I also want to extend my huge congratulations to Dr. Chinna and Professor Arun Tiwari for giving us this gift of this book that demystifies how to do something that's everlasting with our limited time on this earth. So with that, Praveen Garu, please go ahead and release the video.
That's so nice. Thank you, Mr. Chandu Tota. It's so nice, and we are great for releasing this book. Now I invite Arun Tiwari Garu. Okay, he is a great Indian missile scientist, author, and professor. He has written several books and co-authored 5 books with Dr. APJ Abdul Kalam, our former President of India, including Wings of Fire, which is a great book, which was reprinted 30 times in more than 18 languages. Now I invite Professor Arun Tiwari to talk about this book for a few minutes.
Thank you very much. I even can't believe yet that I'm addressing to all of you, great doctors. And I always believe that in our life, there is a hidden hand who make all of us meet and take up some work together. And one of the work is to inspire others. And if you want to inspire others, you must know how to get inspired from others. Because otherwise, it is not possible. You can't simply inspire others. You just have to you yourself get inspired. So I was blessed that I had Dr. Kalam, with whom I spent 33 years of my life. He inspired me. And because he was President of India, so during that 5 years, I had the opportunity to meet in flesh and blood some Nobel laureates, some great scientists, philosophers, presidents. So it was I always used to wonder that how all these great people, they achieve greatness. Or from the same 24 hours, we all have 8 hours we sleep and 8 hours we watch TV or do any passive work, waiting outside the window, gossiping, water cooler talk at work, and same thing discussing with the spouse and children, running commentary. This is what is happening. Trump will come or not. I mean, those inconsequential things we waste our life. But then, how come these people? They become scientists, they become great musicians, they become great teachers, authors. So that how do they do it always intrigued me. So about 10 months back, when through one contact, I met Dr. Chinna Babu, because I'm a heart patient, I'm not a cancer patient. So that is not the route that I met Dr. Chinna Babu. So what I felt was that, hey, here is Dr. Kalam, whom I met in 1982. He was around 50 years old, and so is Dr. Chinna Babu when I met him. So I told doctor that, are you aware that you are a man of destiny, and don't be satisfied with being a robotic surgeon. There's a lot ahead of you. So he was surprised. He says, how can you say that? And then I told him that over years he developed some special kind of visions. And I see it that you are a man of destiny. So that is how we started talking to each other. And finally, this book has come.
Thank you, Dr. Tiwari. It's a great inspiring. First of all, your life itself is a great inspiring to us in many ways, and the contribution you are doing to the world, and especially to India, it's really great. And we really thank you for bringing the words of Dr. Chinababu in the form of book. Chinababu as a person itself inspiring. Now the book will reach to millions who have not seen him and will be a great inspiration. Thank you for taking and talking to him and bringing his words in the form of book. Thank you very much, Dr. Tiwari. Now I request Dr. Chinababu to say a few words.
Great. Thank you so much for this privilege of launching the book on this special occasion of the third anniversary of Global Grace Health. It is so nice to have Honorable Deputy Consul General of India join us, even as we celebrate the 3 years of work of Global Grace Health. So it's such an honor as well to see Chandu Tota, dear friend, who helped us to innovate and bring newer solutions to fight cancer. Back with Grace Cancer Foundation to launch this book. So thank you so much for doing this, Chandu. Really, it's such an honor for me and privilege. So, many people ask me why this book and how this happened. I think Professor Varun Tiwari ji, the whole journey began with his insights, and his wisdom has helped us to kind of shape the narrative of this book. Basically, this is just not just a book, but I would say it's a beacon of hope and strength for those who are battling cancer. I also hope that this book could be a book which could inspire a generation or more of young doctors and others to a life of compassion and care. So I believe my legacy would be to kind of, to see this world is free of cancer. That's what is my primary calling is. So this is more than my story. It is the story of countless people who are very brave and who have fought this disease of cancer with so much of unwavering courage. So I would also say, apart from my story of humble beginnings of to where I am today, and I'm not done yet, and this is just the beginning of another bigger innings that Tiwari ji always reminds me of. So it is basically a collection of latest and true knowledge about the science and the treatment and the prevention of cancer. So it is not just a biography. It is basically how you and I can live a life of legacy in whatever we do. So that is the basic essence, and the reason why I think the chair of Global Grace Health has chosen to launch this book today is because some of the significant work that we have done is either through Grace Cancer Foundation under the leadership of Sri B.L. Sujata Rao Garu, or through Global Grace Health, under the leadership of Joseph Paturi Garu. So, and of course, many of you have, in one or the other way, have contributed in the work that is being done, across the world, not just in India. So, on this occasion, even as we launch this book in US, I consider this as a great privilege and honor, and I thank my dear friend and mentor of late, Professor Varun Tiwari ji, for for this privilege and for the patience with which he has brought this book out so beautifully. Thank you all the doctors, friends, and the co-partners at the Global Grace Health for making this happen. Just before I close, I just want to comment or make you all to think. As we release this book, we do more than just share knowledge and stories. We also ignite a flame of hope and solidarity in our collective battle against cancer. I would say we are embarking on a powerful mission to transform lives across the world. Thank you all for being such a blessing in my life and for being part of this legacy of compassion and healing, even as I work to reduce the burden of cancer in this world. One thing I want to put it across and close: we live to live, and what we leave behind will live on in the hearts of those who we touch with our living. I say this is as much exciting as fearful. My life's dream is to make this world cancer-free,
I hope that is my legacy. Each one of us have a choice to leave a legacy. Each one of us have a choice to make a difference. It all depends on what you choose. What is your legacy? Live the mandate to leave a legacy. Thank you so much.
I really thank you, Dr. Chinababu. It's such an inspiring one. Okay, leave a legacy. It's not just your story. I know it is so much of inspiring to every one of us, and it's a challenging. And with a great burden, you narrated this to Dr. Tiwari, so Professor Tiwari, and thank you, Professor Tiwari, for bringing this book. It's challenging for ourselves also, to every one of us, how to live for legacy, what we are leaving behind. It is fearful, as you said, we have to live for the legacy, whether we good or bad, what we are leaving. Okay, the way we live, it will inspire and it will give the legacy for the next generation and coming centuries. As Professor Tiwari said, as India is becoming Vishwaguru, you are all our gurus, okay, directly or indirectly inspiring and challenging us. Professor Tiwari, Mr. Chandu Thota, Shinababu, Sujata Rao Garu back in India, Joseph Paturi Garu, you are making a great impact on our lives and inspiring us to give back to the society and live for the legacy as you lived. Thank you very much, Dr. Chinababu, Professor Tiwari, and the rest of the team. Now I request Dr. Joseph Paturi Garu to proceed for the next item, vote of thanks.
Echoing the same thought on legacy, Dr. Chinababu, as he shared, and Professor Arun Tiwari as he shared, every day as I get up with this thought: we are all given only one life to live. It will soon be past, and what we do with it will only last. We are all given only one life to live. It will soon be past, and what we do with it will only last. That challenges me every day. That inspires me every day. That motivates me every day to do what is really meaningful and purposeful, and that we can leave, every one of us can leave a legacy behind for the posterity. As part of proposing vote of thanks, we are so grateful to everyone that joined today, and even those that could not join but would be watching the video even later on. Especially for those who participated and shared in different areas, starting with Dr. Varun Jeph, as he brought his inaugural address as Deputy Consul General of India and a medical professional himself. And likewise, our keynote speaker, Dr. Madhu Kandarpa, and also Dr. Alok Agarwal. Of course, he could not be there for too long because he got another appointment to run to the hospital. We're so thankful for everyone, particularly these two doctors, keynote address as well as special guest, Dr. Alok. They came on at a very short notice. Originally, we scheduled Dr. Surmit Bedi to bring keynote address, but there is a funeral for her today that she had to be involved. That is how she requested whether these two friends can come and share at our event today. And we are so grateful for all the board of GGH and the board of GCF and all the supporters and all the well-wishers and partners for everything that they do for the work to serve the humanity. And we are especially thankful to Chandu Todagaru for his huge support that he brings for the work of these both entities. And this is not just the end of it, but it is just the beginning of it. There is so much to do. Our lifetime may not be enough, but each one of us can make an impact. The best is yet to come. Thank you so much.